So we are back for another discussion and an exciting topic. So my name's Dhalia.
I'm Hayley.
I'm Rachel.
So one of the things with plastic surgery is that people have really high expectations, and they think for some people they have saved up a long time for their surgery. They've seen the social media, they can see what plastic surgery can achieve in other people. And I just want to talk about managing expectations, what plastic surgery can do and what it can't do. And one thing I see, particularly with facial rejuvenation, there is this massive expectation that you can give people instantly clear skin, wrinkle-free in every aspect of the face, and lift it, which we can't do. What was your expectations when it came to, what was your knowledge of facial plastic surgery?
I think it was more one and done. So you will be able to create miracles, but actually that is not the case.
I think I was the same before being involved in it. I would have assumed it was everything done.
And as we've seen, we do a lot of faces, and also with my colleagues and around the world, you have to have, it's a multimodal treatment process. So first of all, we deal with a lot of serums and managing your skin at home. So managing your skin at home, people underestimate how much of a difference managing your skin at home alone can make. If you did no surgery whatsoever, and if you ate healthy, drank healthy, started your serums such as retinol, vitamin D, you get a great result. And if you don't mind me saying, that's a route you took, isn't it? So what was your experience with that non-surgical aspect of things? How soon, what was the most difficult part of dealing with the non-surgical route?
I haven't found anything difficult. But then I was someone who would have done a bit of a daily routine anyway. So I guess it's just allowing yourself that 10 minutes in the morning, 10 minutes at night, that bit of time. But I really like that because that's me time. And then it's just finding the products that are best for you. So that can be a little bit of trial and error. But then obviously you recommend, don't you, with the retinol and, you give the correct...
You did have a little bit of surgical treatment.
Yeah.
But it wasn't a big general anaesthetic.
No, it was my eyes, but obviously it wasn't an area where like the face gets tight, and it's quite a separate thing with the eyes.
Yeah. And you went down the non-surgical route as well with maintaining skin quality.
I think since I started working here, I didn't realise, I'm a skincare girly anyway, but I think I didn't realise how important it is to do and how much it can prevent later having surgery. So if you invest in your time now, then it will really help prevent surgery.
I feel it's made a huge difference.
Or you can have little treatments, not a full face. I think that's where I would like to go later on in life, where I go under a local and just have like a blare, maybe a little temple lift, some acid on some lines.
Yeah.
Maybe go down that route.
Yeah. And I think that's a really good way to deal with things, particularly, you're setting yourself up for the big operation if you choose to go down it. But the other thing is, because there are so many different things that you can do your face, there's this thing in surgery. If there's so many different forms of treatment for one particular thing, it usually means that nothing really works for everybody. Okay, so when it comes to skin tightening, for example, we've got chemical peels, we've got serums, we've got devices, we've got radio frequency. The reason why we've got so many different things for everybody is because there is no one overriding answer to give you what you want.
And everyone's skin is different.
Everybody.
And the lifestyle they've led prior to seeing you is different.
Exactly.
Yes.
Yeah. Smoking and drinking
Yeah.
will have such a big impact.
They've worked
on your skin.
outside all their lives.
Yeah.
So because there are so many different things, you have to have a specialized consultation to see what would work for you. It's not like breast reduction. If you want to reduce your breast, there's a very specific type of procedure. We know that breast reduction surgery works. With face, a lot of it has to be trial and error.
But it's not, even once you had a facelift, it can't be like, oh, I'm done, I've had a facelift. You still have to keep looking after your skin because it will help maintain that if you let it go.
That way then, or have surgeons in the past tried to sort of do it as a one thing and then off you go, that's it, you've had your op, do you think?
I think social media have tried to do it, has
Tried to make it appear that way.
Make it appear that way because it makes it more lucrative. You save all your money and you have this operation and you'll be fine. And
And there's like a psychological part of it as well, isn't there?
And I think that's a really important key thing that you mentioned, psychology. And people have saved and researched to have something done, but it's up to us as surgeons to decide whether that is actually going to make a difference to them. Because why do people want to have a facelift? Are they being pressured? Do they want a job? Do they want, so success, what do we deem successful? Is it someone that looks good after the surgery? Is it someone that came to you because they wanted to have surgery, because they wanted to find a partner? Or
Changing themselves.
And that's where we have to psychologically identify what is the real
it's just
reason.
down to a lack of self-worth. That doesn't resolve that.
Exactly. So it's about identifying those patients and treating that aspect of things before you commit. Why do you think people want to have plastic surgery to improve their looks?
There's obviously the older lady want to look younger, which is fine. And it's not even looking younger, but they just want to look fresher on themselves. But I think younger girls are now wanting to have more bits done to their face at a very early age, because I say very early, but when should you really have a facelift? What is the right age? Is there an age that you should?
There is no age, and there are surgeons out there that are doing facelifts on 20-year-olds and 30-year-olds, so very, very young people. So there is, because there's no need for a facelift, it's a want. And it's whether your surgeon feels confident enough to be able to make positive changes to your face through surgery.
Okay.
For me personally, I would never do a facelift on someone until they are psychologically, and that I've identified that there are no other psychological issues.
Yeah.
And once I'm confident with that, and they are there just to make themselves look fresher, younger. It depends on the original quality. I think for me, the ideal time to have a facelift is someone who's in their mid-50s, late 50s.
Yeah.
Early, that would be the earliest, and then later on. But people in their 30s and 40s, if they've got normal average skin, in my hands, I don't feel they will get a positive result long term. Short term, they will. Maybe, because they're morphing themselves into something different. But long term, I don't think.
Because there was that lady comedian, isn't there? She's Canadian. She's here in the UK. She's had a facelift. I think we're similar ages. But she felt, I think, after she had her latest child, she just felt tired and wanted a bit of a juju. So she found a surgeon in the UK who's done her facelift. I think she's about 45. I think
a lot of this comes down to a fear of aging. Or that it's not,
I mean, she looks good.
That it's not acceptable to be aging, which I find quite difficult to get my head around. That it's almost to be ashamed of going through the aging process. How do you feel about that? Because
I think that as a surgeon, you have to listen to the patient and the patient's individual. But as a person myself, I think it is a big problem. in society that we have today. And social media has a big part of it.
Yeah.
Expectations, celebrities doing what they do and then selling what they do.
But children are not going to know what a normal aged person looks like.
No, not anymore, they won't.
Obviously, a lot of what you do life-saving operations. This isn't just about cosmetic, is it? You save people's lives, reconstruct their bodies. But yeah, I think it's...
But I think as women, when you get older and mature, which is great, and embrace it, but I do think some women just start feeling invisible and that they just want to be seen again, as they were. And I think that is a difficult thing.
But why have they been made to feel like that? From what?
I think it's just you do become a bit invisible. I mean, I definitely don't.
So are we talking about people in their 40s or old?
From 40s upwards, I would say,
So would you say you feel more invisible?
No, I feel like I look the best I've ever looked, but it's different because I found you. But I think you do start feeling that,
Do you think you felt invisible as you matured?
No, I don't feel so.
But you're confident.
Yeah, I mean, but I do know of some women that do feel like they, they've had kids, they're now going through menopause. I do think 40s to mid-50s is probably one of the hardest time for women. And then you get past that and then you feel great. But I do think it is an adjustment. You are dealing with, you've had all your children, you're coming out of that. Your body is never going to be the same to a point. You're now grown, you're now older, you just want to now get your life back, but you're not, you're not in your 20s anymore, you're not in your 30s anymore.
But when you talk about what you can and can't do, you cannot actually reverse it completely and make someone be what they were, like when they were 20 and prior to having children, can you?
No.
The skin texture is still going to be different, isn't it? And
the hands and neck are different, everything is showing an age.
So you've both had a glow up in the past a year or so.
Yeah.
Do you feel more seen after your glow up?
No, I don't feel any different in that way. I just feel happy. But yeah, it's not about being seen or attention.
No, I will agree with you with that. But I do think for the older ladies, not all of them, but I do think they feel, because equally that generation was a completely different generation to what we grew up in. I think they just want to get, younger, try and look a bit younger. There's a lot of pressure, as much as sometimes our generation feels pressure and the younger ones do. The older ones also are feeling it. I don't, think it's just you get older and embrace it. You try, but I don't know.
So basically every generation is feeling some kind of pressure.
I think so, for sure.
Well, I think it's quite sad.
But you are Mother Earth, and I love that.
But has it always been like that?
I don't think so.
I don't know.
I don't think so.
I think we're always
I
fighting
don't recall
for you.
that, even as a child, that being what I was bombarded with, or what would then be the older ones for me didn't talk about things like this.
Is that because it wasn't available and it wasn't accessible?
Yeah.
I mean, we all, the biggest legends and the stories that you hear is looking for the elixir of youth and, all the big old-fashioned stories that remain young forever. So there is that fantasy of wanting to remain young, but physically acting on it, probably because it wasn't accessible, people didn't do it. But now, because of the social media, it's all accessible.
Yeah.
So the desire to be young has always been there, but it's kind of been unleashed because of the accessibility of the tools that
I don't want to look old.
Well, that and people are living longer now, I guess. 40 odd years ago, what was the age span? Maybe in their 70s. Now we're looking at 90s, aren't we? So maybe that's changed things as well, that we are actually here a lot longer.
And the products, there's more products that are available, serums, all these different things that we didn't have before. And we do have ways of, doing stuff like blefs. I would definitely have a blef later on, for sure. Because it does your face is completely transformed from having that. And it's a nice little procedure. You're in and out. I quite like a blur.
Yeah.
I think that's my favourite procedure
Yeah.
to see you do. Yeah, for sure. Yeah.
I mean, what we are doing obviously works.
Yeah.
In society, because one of the things you pointed out in one of our previous podcasts is you were looking at the Golden Girls, and there were similar ages.
Who are I'm actually older than a Golden Girl.
So
Crazy.
So it works.
Yeah.
What we are doing now is kind of reversing how people look, and is making people look younger than our grandparents and our great
I think
grandparents.
people are just trying to look after themselves more.
Yeah.
You know, what was it, a couple of years ago, we were all body embracing the bigger body. We're now not doing that anymore. Everybody's now on these fat jabs.
Healthy, isn't it?
Yeah.
The best you can be, and strong.
Right.
I think the emphasis should be on strength and wellness. Movement of the body, you know, actually using the muscles and, you know, having a body that performs for you.
But people aren't drinking anymore like they used to. No one is partying like they used to. The younger generation are so, you know, skincare routines and even from a very young age. Young girls are now doing these 7 steps and like 12. You know, it's a different thing now. We are very much all doing stuff to try and help our skin and glow up and eat the right things, take all the supplements. You know, we weren't drinking collagen. We weren't drinking collagen back then. I mean, I'm taking collagen every day.
Yeah, but I also feel that all that stuff, the goal is to look younger.
Yeah, it is.
Not necessarily internally be younger. So
no, green juice.
I don't think people are exercising as much as they used to. Obesity is still the same.
Is it?
The focus isn't on wellness of the body.
Yeah,
You're
it's
saying
about
it's
the focus is on.
Yeah.
You know, Manjaro, for example, it's all based on looking thin. And yes, there is evidence to show that it reduces diabetes, etc. But the goal, most people that I know are on Manjaro that are already fit, and they would just want to look slim. So I think their intentions, I think, is to look good, not necessarily
be healthy.
But I think everybody has their own different things. Like some of my friends, they want to be more muscular, you know, strong. I'm not one of those. I want to look.
Why do you want to be muscular and strong?
Well, one, I think it's because it's very much evident now that you should be lifting weights for when you get older, so your bone and all of that. I kind of feel like I just want to lift weights that I'm happy with. I don't want to look muscly. I don't. I'd rather look lean. But there are now different looks that people want to do, and everybody's entitled to have their own.
And I quite like that. I think that's
great.
Yeah. There is no one standard image.
No.
There's a muscly look. There's like you said, there's a leaner look. There's the slightly voluptuous look with the big hips, and there's the small boobs and the big boobs. There is a versatile. So that's a positive thing, I think. There's a versatile range of looks that people can go for that's more suited to their personal needs. So that's rather than going for one very skinny.
I think it's good that everybody's just trying to look after themselves in the best way that they possibly can. I think for me, skincare, you just need to get your skincare in. SPF, serums, morning and night routine, red light. Just do everything that you can, because not everyone is going to be able to afford, you know, a facelift, because in 10 years' time, it's going to be more expensive. Everything is expensive. So invest in your skin now for later on.
With all this stuff.
Yeah, because not everyone's going to want a facelift. But if my face doesn't go though I want it, I will be seeing you in 15 years.
Would you proceed?
I don't feel like I would at this point, really.
I think it's a very invasive surgical procedure, and you have to decide. And a facelift isn't just a facelift; it's so many different types of. It's like It's like saying, I want to build a house. There are so many different houses you can build. There's so many different rooms.
It depends what the rest of my body is doing, because I wouldn't want one bit. You know,
but you can cover this with clothes. You cannot cover this.
No, I know, but still.
And you look great, so.
I think I'd want it all to be going at the same pace, basically.
But you look good. So if I look like you, then I'd be happy. But if I start going down south, I'm going to want the whole job.
No, you won't go down south.
Well, not with you, no.
No. Anything else you want to tell?
Just that I think it like cosmetic surgery is not for everybody. But, you know.
You're right, cosmetic surgery isn't for everybody. There is so much behind cosmetic surgery.
Yeah.
Physical, psychology, work, family, and just not everyone is suited for it.
No.
An honest surgeon will say, no, you're not suited for it.
And even if you do have it done, you still have to keep investing in your skin.
Yeah.
You can't expect that if somebody in their 60s have not ever really done their skincare, the skin is looking liney and leathery. There is only so much a surgeon can do. So if you do want to have good results, invest in your skin now. So if you do want to have a facelift later, you're going to be happier with the result.
Yeah.
Great. On that note, that was another interesting discussion about expectations, and hopefully we'll see you in the next one. Bye.